During the crisis, firefighters still have to respond to calls, especially for those people that are sick or maybe even displaying symptoms of COVID-19. It's fortunate that in our regular course of duty, we already deal with people who may have or are confirmed to have some sort of communicable disease, whether that's hepatitis, tuberculosis, things that are bloodborne. So we're well prepared to deal with those things. We have gloves, glasses, N95 masks. We have the procedures on how to use those safely, how to decontaminate them, and how to do things like limit responder exposure by not sending the entire crew in. If someone obviously has signs of a communicable disease, we limit exposure to one person contacts the patient. That's one person to decontaminate when we come out rather than four. We have looked at expanding the equipment as well because of the severity of the outbreak. We've included goggles in the cache of personal protective equipment, face shields, additional Tyvek suits for decontamination afterwards, or even wearing into a call where someone has either a confirmed case of COVID or has a productive and persistent cough. The public can assist firefighters and all health care workers during this crisis. Firstly, if they're calling 911, please be candid if there are any diagnostic questions about your recent travel or signs and symptoms of COVID-19. It is not going to affect our response in any way whatsoever. We won't come slower. There won't be a reduction in service. We just need to know to protect ourselves and to better serve the patient. So please be honest with the call taker. When we come to someone's home, this is still a good time to practice social distancing. We're going to limit responder exposure by probably only sending one staff member in. If family members, even if they're there to translate or help us, if they could keep a safe distance from the staff members, we're just trying to limit everybody's exposure to us and our exposure to them as well. So keep a safe social distancing, help us at calls. But I would also say, please help us reduce the number of unnecessary calls. If you're going to go out for a mountain bike ride or go climbing or any of those kind of things, please be a little careful, dial it back a little bit. We don't need to go to traumatic injuries when we're already being taxed by the COVID crisis. And lastly, I would say there's no need to hoard medical supplies unless you are directly impacted by, you're showing signs and symptoms of COVID-19, you're in the vulnerable population because you're immunocompromised, or you're a healthcare worker. There's not a need to have N95 masks or go out and hoard sanitizer or other medical supplies, because the healthcare providers are struggling for them right now, and that's just taking away from the vital need they have.